Good afternoon. Hello, everyone, and welcome to today's event, Post-Pandemic Civic Engagement, Lessons for a New Normal. My name is Sadia Sindhu, and I am the Executive Director of the University of Chicago Center for Effective Government at the Harris School of Public Policy. I'm thrilled to dive deeply together into a topic that is top of mind as we begin returning to normalcy on the other side of a challenging year and a half. In the midst of a once-in-a-lifetime global pandemic, life as we know it has become radically different, and we were forced to adapt to new realities, even as our country confronted huge challenges. From combating racial inequities through policy, activism, and protest, to administering a critical national election, to fighting the pandemic itself, the issues we faced required our civic institutions and leaders to adapt in order to engage the public, implement effective policy, and effect change. We've certainly learned a lot during this time, and there are no doubt lessons that will inform our approach to civic engagement long after this pandemic subsides. Today, we'll hear a group of accomplished leaders, all with a range of expertise and experience in the civic space, share their learnings from this volatile time. I'm so eager to get this discussion underway, and I'm sure you all are as well. But at first, it's my distinct pleasure to introduce our co-host and moderator for today's discussion, Sonal Shah. Sonal is currently a CEG Senior Practitioner Fellow and founding president of the Asian American Foundation. As one of the foremost global leaders on social impact and innovation, Sonal has started and led social impact efforts in academia, government, and the private and philanthropic sectors for over 25 years. Sonal founded and led Georgetown University's Beck Center for Social Impact and Innovation, and served as a deputy assistant to President Obama and as director of the White House Office of Social Innovation and Civic Participation. Sonal also served in roles in Pete Buttigieg's presidential campaign and the Treasury Department and at Google. But before Sonal did all of this, she was an undergraduate student at the University of Chicago. Sonal, welcome home. Thank you so much for being a part of our CEG team this year and for leading us through today's discussion.
Sadia, thank you so much for your leadership and for everything that you do. It's been a real pleasure, and really what you are doing at CEG is so important, and I'm so proud to be a fellow here with Jennifer, and I'll introduce her in just a second. Let me go through all the bios, but this is an important discussion about the role of what is civic engagement post-pandemic and really what lessons have been learned and what a new normal might look like and what we think about. And this is really the moment to be asking this question and saying, and what could we do? What should we be doing differently? What have we learned, and how might we do things differently moving forward? We've got an incredible panel here that can talk about this. They have experience in so many different realms and so many different places that I can't imagine a better panel in having this conversation of how do we think about civic engagement post-COVID. So with that, I'm going to start just quick bios of everybody. They are available online. You can find them. But what I really want to do is get into this discussion because of this group and who they are. So let me first start with Berto Aguayo. He is the co-founder and executive director of Increase the Peace, an organization that develops young leaders and promotes peace through community organizing and policy advocacy. From 2013 to 2016, he coordinated Hoops in the Hood program in back of the yards. In 2015, he was appointed to the mayor's office of My Brother's Keeper cabinet. And in 2016, Berto founded ITP. Since ITP reopened, it's opened a community center, trained hundreds of residents in community organizing, and organized dozens of actions to increase the peace, and has expanded its work to violence prevention, youth development, food access, mutual aid, and multicultural unity. Berto, it's so great to have you here. And I think the work that you are doing sort of reminds us that everything is interconnected. We don't live in our silos, but we really have to think about this all together. Our second panelist is Jessica Biggs. She's an organizer and director of Southwest System of Care, Southwest Organizing Project. She leads Southwest Organizing Project in developing and implementing Southwest System of Care, bringing healthcare and behavioral health and social service organizations together with neighborhood organizations in an integrated service delivery model that increases access and coordination of care. Prior to her work as an organizer, she served as a principal of Burke Elementary School in the Washington Park neighborhood, where her leadership centered around community partnership to move the school from probationary status to good standing. Jessica, it's great to have you here. And again, you're another person who sort of brought a variety of different experiences to really understanding how we bring communities together and the work that we do. Our third panelist is Dr. Kavita Patel. She's a non-resident fellow at Brookings Institution. Previously, she was the managing director of clinical transformation at the Center for Health Policy at Brookings. She's an advisor to the Bipartisan Policy Center and a member of the Health and Human Services Physician-Focused Payment Model Technical Advisory Committee. Dr. Patel is a primary care physician in Washington, D.C., and she also served in the Obama administration as Director of Policy for the Office of Intergovernmental Affairs and Public Engagement in the White House. And Dr. Patel, I still get that name wrong every time I say it, and I've said it a million times, but it's great to have you here. We've seen you on TV. We've seen you talk about the importance of coordinated care, but really thinking about how we approach this COVID crisis differently. So it's great to have you here. And the last panelist is Jennifer Horn. She is a co-fellow with me at the Center for Effective Government. I'm so happy to have her here. She's a political strategist with over 30 years of communications experience. She's a member of USA Today's Board of Contributors. Jennifer is a co-founder of the Lincoln Project in 2020, where, among many things, she led the efforts to build Republicans and Independents for Biden, a national coalition of over 150 leaders that included former governors, senators, members of Congress, party leaders, state legislators, and activists. She was the chair of the NHGOP from 2013 to 2017, during which time she served on the executive committee of the Republican National Committee. Jennifer, it's great to have you here, and I think your communication skills and just really the breadth of all the work that you've done is incredible. So let me start with this conversation again. I think let's sort of ground this in a bit of where we are with COVID, where we have been with COVID. And Dr. Patel, I'm going to start with you. You're both a practicing physician and you've worked in government. And when we think about engagement, when we think about civic engagement, we generally always just think about getting people out to vote, but really it's more than that. It's about how institutions communicate with people. It's how people work with institutions. It's how nonprofits work with governments. There's so much in civic engagement that's important. And what I'd love to get a bet from you is just, as you think about your role in government and where you are today, how could institutions engage communities differently? And how should information be communicated when there is so much uncertainty? I remember last year during COVID, there was so much uncertainty of what we should and shouldn't do. How do you think about this? And you were one of those people that came out constantly. We're talking about what we should and shouldn't be doing and trying to translate that information. But as you sort of step back for a second, what are things that you've learned and that we should be thinking about?
Yeah, thank you. It's always great to come and talk to such an esteemed audience. So I want to thank the center for inviting me. I'll be brief because this in and of itself is probably a course. It might actually be a literal course. I'll say, not just as a former kind of government person, but especially all of us who are in healthcare kind of had to get thrown into roles that we're not used to. And it really mimicked, I think, what you touched on, Sonal. So when I think about kind of what could we have done better, effective coordination, communication, all of that is going to be the very obvious. I would say underneath it, though, has been something that political scientist John Kingdon, when I was doing my political science work way back when, reminded us of like kind of the multiple streams and the policymaking opportunities when you deal with the politics and the policy and the problems. That in and of itself is exactly where communities, both community-based organizations as well as institutions of government, local, regional, national, needed to really kind of come together. So we were identifying problems, not just from the clinical front lines, but just the real world. You had businesses that didn't know if they shuttered, what would they do? What are the thresholds to reopen? You had people, schools were the perfect kind of case kind of study of what went wrong in so many ways because we shut things down, tried to build kind of remote capacity, didn't do that well, and never really understood any of the ramifications. So how could we have done it better? I think it's safe to say all of us probably stay up all night thinking about this. Number one, having kind of a strategy in place for when you can't have the typical playbook in government. So all of us have become used to whether it's big B bureaucracy and bureaucratic or kind of little government, little g, we've all kind of gotten used to the way things work. And we also have acknowledged how they don't work. But I think none of us know how to live in the in-between space. And especially as effective leaders of these organizations, we need to have an understanding of how to take on a risk-bearing entity when you're not doing that. People go into government because it's usually less risky. I would argue the pandemic has taught us that the most risky, or the people that need to take the most risk, are these very institutions and these very leaders. That's not leadership capacity that I see. I didn't receive it. Sonal, I'm sure you didn't receive it. but it was called upon in this last year. And then the second, and this is very brief, when I trained as a health services researcher, buried in my bio several decades ago, like the community kind of mantra when we were trying to understand depression in South Central Los Angeles was like nothing about us without us. And we had social media became the only feedback loop to understand how, quote unquote, the community was responding to COVID. I got more information about what was happening on the ground through a combination of Instagram, Facebook, and Twitter than I did from actually receiving official communication out of the very organizations. No matter what your political stripe is, there is a role for trust in government. It is who we looked to, whether it was the CDC or our county state officials. So that feedback and nothing about us without us, creating that communication loop as well as clear communication across those channels was something I've learned. And by the way, so still to this day, if you think about communicating around safety and vaccines to children, trying to understand, if I'm vaccinated but my kid isn't, can I go inside a restaurant? We all have to wear a mask? Those are the very real world questions for which we need better conversations and better solutions. And we need to actually listen. And I don't say this as a strike against any particular sector, but I would say we could all do that better.
Yeah, Kavita, you raise such important questions. So the first, I just want to address uncertainty and living in times of uncertainty and knowing how to navigate uncertainty or those in-between spaces, as you say, is something that, you're right, none of us were trained for. I definitely was not trained for it. And it's something, if anything, we know going forward, everything is going to be uncertain. So how do we live in uncertainty is going to be a question. And your second point about these communications loop and have we become out of touch with the communities that we are supposedly serving, and how do we reconnect with them? So Berto, I'm going to bring you in because this is exactly what you do, right? You are in touch with those communities. You are working in those communities on a daily basis. How do you see it from the other side? How do communities effectively communicate with institutions? What is missing in those links? And what do we need to do better as we get there? Because, you're engaging communities differently. You're thinking about them from human perspective first, not as things that we need to do, but as people that need to work together. Would love for you to step in. And I know you're on mute, so I just want to make sure you unmute yourself too.
There you go. No, thank you so much. And the nothing about us without us, Kavita, like really resonates with a lot of the work that we do. And I would also say a lot of the work that I do is influenced by the fact that I live and was born and raised in back of the yards and in communities in the south side of Chicago. So a lot of the shared experiences are also the struggles that young people are going through now are the same struggles that I was going through when I was younger. But I think when I think about authentic engagement, though, like I really do think there's three components to a lot of the work that we do. Firstly, on that note about nothing about us without us, the difference between engagement and outreach, meeting people where they're at, not just figuratively, but literally, and then engagement that really models the aspirations that we have for our community, the highest aspirations that we have for our neighborhoods. And on the note about engagement, not outreach, right? One of my mentors, Rod Joy, once told me, right? Outreach is a one-way street, right? You're going to communities and you're giving them something. And engagement is a two-way street because the people that are closest to the problem should be influencing, right, the solutions. And we have to trust people in our communities to not be helped, but to help themselves, to have the tools to be able to change our own communities, because our young people, our elders, residents in the neighborhood, when given the opportunity, they will devise strategies that work a lot better than most people who are outside of the community will. An example of that, meeting people where they're at, when we knew that before the COVID-19 pandemic, we were living through the epidemic of gun violence in our communities. And we knew that in neighborhoods like back of the yards, a lot of that is influenced by youth that don't have employment opportunities and are disconnected. So we decided to hire young people and say, hey, how do we engage older residents? Because our young people, since they were younger, they were already helping parents, immigrant parents navigate systems. And this is no different. They have the social capital to help people register online. So we put that to use, and our young people said, hey, let's go to the taquerias, let's go to the laundromats, let's literally meet people where they're at. And within a couple of days, I remember when vaccines became available in our community, our young people and the coalition of partners in our community ran out of slots for the vaccine, because that's how fast, and they were meeting people where they're at. And it was a a strategy for the community by the community. And then lastly, on modeling the engagement of and really modeling engagement that seeks to model the highest aspirations of our community. I think about working collaboratively, because there is a lot of division, a lot of, what we call nonprofit gangbanging, right, that occurs in our spaces. But we gotta know that we can't do this work alone, right? We gotta have partners, and we gotta be able to draw the links with folks like SWAP and Jessica, right, and La Casa Norte, and other coalition of partners that are doing the work, because we all do a little different. And if we're divided and we're not united and have a cohesive strategy, then how do we expect our community to be united, right? So I think those are some of the points that I wanted to make sure that were brought up, that I think are key to having genuine, authentic community engagement.
Yeah, Alberto, you make so many great points here, and especially just meeting the community where they are, and also understanding how to engage them in a way that they can engage their own communities. So really building a model that works and what you're doing. I will come back to you with a different question, but really just to keep it on your mind as we come back to this is, how do then you take what you're learning from the community and re-communicate it back to institutions that are making decisions? And that's a question I'd love to dig into as we do that. But let me bring in Jessica. Jessica, I know you and Berto have worked together. I'm so amazed at sort of where, everything you're doing. And I know we've learned over time that, education and health aren't disconnected. Like those are very connected pieces, as Berto also has mentioned. And Kavita knows better than anybody. Let's dig into a little bit of what you're doing, and sort of how you've taken on this integrated care through Southwest Systems. But what are you learning? What is it that we should be doing? And sort of how are you learning communications that needs to be different at this time also?
Yeah, I'm happy to speak to all of those things, or as many of them as I can anyway. And I'm hugely excited for the work that Berto and I have, and others have been able to do throughout the pandemic, and are really looking forward to being able to continue in partnership with Chicago Department of Public Health moving forward. But I think that in many ways, this pandemic has taught us what we already knew, but it did so in a way that we just couldn't ignore, right? There's something about watching in real time some of the most deeply human experiences, of suddenly getting sick and dying, that made it nearly impossible for our collective consciousness to kind of otherize the problem in a way that we so often do. And I think instead it made us take a real look at root causes and make sense of those things that were causing so many people of color, particularly, to be the ones who were getting so sick and dying. And through that, we were forced to make sense of people's housing situations, who are essential workers. Sorry, I live near the train, so it's a little noisy. But why rates of chronic disease are so much higher in our communities of color. Our collective structural failures that we were aware of, and were certainly discussed and tackled in certain circles, but rarely really taken on as collective issues. And I think COVID really made us name them for what they are. And I think that's really a first step to addressing them. So, in the short term, when it came to addressing and attempting to mitigate the impact of COVID, we saw government, particularly locally, look to community as the expert in a way that I really haven't seen them do before. Literally going to community and saying, what do you need? What's the best way to get folks what they need right now? And then actually following through and acting on it. So in the longer term, my hope is that we both continue to center community voice as expert, and certainly see structural inequities as our collective problem. In this moment, we've been forced to name that health is not just healthcare. To your point, it is, do I have a consistent, stable roof over my head? Do I have easy, affordable access to food? Do I have access to fulfilling employment that pays me a livable wage? Do I feel safe and connected to my community when I walk outside my door? What should be really basic stuff, but of course is not the reality for too many of our neighbors. So I mentioned the work that Berto and I are doing in partnership with CDPH, and we're starting to get some indication that there's an interest in tackling structural racism by centering the voice of community through plans like Healthy Chicago 2025, which are a bit more theoretical, but tangibly and importantly with funding to support things like Healthy Chicago equity zones. And I think that's a good start in the right direction that makes me feel hopeful that we'll be able to capitalize on some of these lessons.
I did what I tell everybody else not to do. Jessica, thank you for that, and it's so great. And I hear you on making sure we're centering community and really understanding sort of what is the community asking, and then what do we need to give back. But also, I'm happy to hear that government looked to community, during COVID and making sure we were getting the information and the messages out. Certainly hope, and let's dig into this more of how do we keep that moving, and how do we ensure in the long term that there is that robust relationship between government, community, and the feedback loops that we've been, that have been brought up, and how we do that effectively. So Jennifer, you are a genius communicator. So to start with that, you've done an incredible job. We saw with the Lincoln Project, but also you've been in politics, right? And you were in New Hampshire. You were with the Republican National Committee. I think it's important for us to think about, like, sort of, we're talking about civic engagement, and again, there's a world that we always talk about from a political perspective. What you're hearing from Kavita, Berto, Jessica is really also how do we think about civic engagement amongst, with communities and government, with communities and politics. How are we ensuring that the voices, not just the political voices, but voices are being heard? Because people are actually asking for things, right? They are asking for what they need. They know what they need. They're not unexpert. We've sort of expertized people, and it's like the experts told us versus the people who live their lives are also experts. A mother who knows what she needs is also an expert. So this idea that professional expertise is more important than individual expertise is something that we should work about. But I'd love to hear from you. How do we think about this? Like, how do we communicate differently in a world where there's a lot of misinformation, there's too much information, no one knows what the right information is. How do we break through in these moments?
Well, I think you make a great point right at the end there. When you talk, when we're talking about misinformation and the dearth of information that exists out there, like, first we have to sort of take a step back and understand what communication really is. And I think everybody who's spoken before me has kind of hinted at this and made good, presented good examples of it. Communication isn't just taking a data point and having it transfer from one person to another. Communication is about connecting. It's about making the information meaningful, and it's about, to your point, making sure the right information is getting to the right communities, to the right individuals. And I think that what we saw from my political perspective throughout COVID was, in our past political history, when national tragedy has struck, we have come together under the community of our leaders, under the unity of our leaders have come together to lead us forward. Watching what happened under COVID from a political perspective, looking at our elected leaders, one of the things that struck me most strongly was the willingness of elected representatives of the people to politicize a national tragedy right out of the gate. If people will remember, after 9/11, all of our congressmen and senators coming to the steps of the Capitol and spontaneously, bursting out in song. I think it was "God Bless America." Certainly, politics became politics as usual with the consequences of 9/11 in the years that followed. But in that moment, there was a kind of leadership that communicated something to the rest of the nation that was really critical in that moment, that we needed in order to be able to get through that moment and to then access information and knowledge. What happened in COVID, the willingness to politicize the tragedy and then politicize the communication path that followed that, actually became deadly. And we lost lives because of people, because of our elected leaders, and then a lot of others down, kind of followed down the chain below them, the willingness to create and share what they knew was misinformation. We live in a time when it is really difficult to assure that the information we consume is legitimate. It used to be you could turn on ABC, NBC, CBS at 6 o'clock at night and you got the news and it was accurate. You knew it was right. Social media, digital media, the ability of foreign nations to access our communication streams through digital and social media and to influence the way that people in our country think and the way that we process information has been very damaging. But what has been more damaging is when we've seen now our own leaders taking that model of foreign nations who used social media for misinformation and then used it themselves in a political manner, whether for campaigns or advancing information throughout the pandemic. So I think that we have some really serious questions that we still have to ask ourselves. Everybody before me spoke about these wonderful efforts, and thank goodness for those efforts, or we'd be in a very different place right now. But I think that we go forward from here really needing to ask ourselves some difficult questions. I think that communications, the path of communication has been damaged under this pandemic in a way that is going to be very can be very damaging going forward if we're not all aware of it as individuals. Why are we willing to believe information that at any other point in time we would have known it, looked at it, and instinctively recognized that it was ludicrous, that it was ridiculous, that it could not possibly be true? Why are we willing to do that? And I do think that to some degree it goes back to what I think it was Dr. Patel mentioned earlier, that we have lost, that too many Americans have lost trust in government, in institutional entities. And I believe personally that there is a political benefit for some people to continue to feed that mistrust in government. And I think that that's happening. And I think that the efforts that Berto and Jessica and Dr. Patel have talked about that have been very community-based, community-oriented, that's where the solution lies. That's how we solve that problem. And really, there needs to be more and more and more of that, where we are coming together at the grassroots level, to use a political term, at the community level, to learn what we need to know, to advance the solutions to the problems that we face, and to better educate ourselves and each other on how to process the information that we are confronted with on a daily basis to begin with. I hope that makes sense.
Yeah, no, there's so much to unpack there, Jennifer. So I'm gonna try to take threads of these different pieces. But one, I think, one on just this question of like why we are willing to believe in misinformation is sort of an important question in itself. But the second question, and I think you mentioned this about Berto, Jessica, Kavita, just this concept of where people trust is really in communities. I wish I had the data point in front of me, but really the highest trust right now is between people and community organizations, not really with government. And then thinking about how do we build those bridges from community organizations, people to government, or to institutions in general, because really we have to rebuild a trust in society. If we don't trust each other and organizations don't trust each other, it doesn't make a difference. You can't, we have to, it's collectively, we also need to do stuff together. But let me start with Berto. I would love to hear from you a little bit. I'm going to dig into this question of misinformation. You're at the community level. How do you think about this? How does social media play a role? And I'm not going to go into misinformation per se, but what's the role of social media, digital in this space? How do your young people interact? Where are they getting their information? How do you ensure that that is working?
Yeah, I think before I dive into the answer, I just want to give out a shout out to our CLA class of 21. We just graduated last week, so shout out to the homies. But I think one of the ways in which social media has played a role for us is amplifying the trusted messengers in our community, right? Like the folks that people know, that, for instance, like our street vendors, right? They know everybody in the neighborhood. They get vaccinated, right? And being able to amplify their story being able to use social media as a tool for amplifying those stories that usually don't get heard of the real on the ground trusted messengers, right? That person who works at the beauty salon, and everyone knows because that's where they go every other week to get their hair done. You know, they're gonna trust someone like that far more than someone from an institution that may not be rooted in community. Additionally, we also use social media. I remember, like, for our pop-ups, we would literally have vaccine registration outside of a grocery store, and we would live, you know, our young people would do a live video and invite community residents to come out. And because we have already established those relationships, social media allows us to be able to activate those relationships and being able to leverage those for change. And in terms of the tackling the misinformation, I think there's ways to do it by amplifying these trusted messengers in our community, people who are rooted in the neighborhood, people who they see every day, you know, at their local laundromat, outside of church, because they will be better able to dispel the myths, the misinformation than anyone that's a so-called expert, because they're an expert on the ground in the neighborhood who people can trust.
And Berto, let me just dig one point here, and I'm just going to link this a little bit too, and I hope to bring Kavita into this too. How do you get that information? How does an institution get that information to you? How do you know it's trust? Like there's this sort of link in between still, right? So there's the community that's there, and then there's sort of how do the government and institutions work with communities effectively that it's trusted?
Yeah, so one of the ways in which we started doing that was we do have, you know, community collaborative roundtables. Like when the vaccine clinic was opened up in Back of the Yards, we were working with UI Health and other folks who were, you know, they knew how to give trainings to young people on vaccine information, on anything related to health. And then we would then take that information and that training that came straight from our partners and the collaborations that we had built. And then we basically translated it into our own language, right? Into language that meets people where they're at, right? Not the jargon and the technical terms that we got. We're able to translate that jargon into things that, you know, folks in our community understand, that is actually a little bit more appealing, right? And then having and educating like those trusted messengers who, you know, will then help us be the ambassadors to the truth, ambassadors to the information that is accurate and that we've gathered. And there's that kind of that link, right? But I think that link is important because if you don't know the language of the community, the language of our neighborhood, right? Not just, I'm not talking about Spanish, right? But just like the vernacular, right? What people can trust, I think then the link becomes a little harder to draw, if that makes sense.
Yeah, no, absolutely. So Kavita, and Jessica, I'd like to bring you both into this piece, and then I'll come back to Jennifer in a minute. But I think when you think about Kavita, you were at, you know, intergovernmental affairs at the White House. Like, how do you think about, like, now that you've been out and you're watching this pandemic, how do we rebuild those links? How do we make sure that there's enough information, but that governments and others have the ability to move forward and communicate to, you know, to organizations like what Berto's doing, and making sure that link continues to stay? And how do we stay in this in between? Like, we're going to be in this in between for a while that you mentioned. What do we do? What's the muscle we need to build?
Yeah. So also I feel like we can do dissertations on this. So I'll be very, very brief. Maybe somebody wants to. Number one, I think that we have to have transparency about what we are currently. Like it's just very, like, we can all walk around and say, oh, community. And then we can also talk about, oh, you know, diversity, like the most common words I hear. But then when you look and ask an organization, including governments, including all the way from, Sonal, you know this, the White House, all the way to volunteer committees, like at a grassroots, at, you know, a council level, we need data and history and understand what has that looked like over history. If you're in a segment of, if you're living in a neighborhood where the predominant population is Hispanic American, and yet all the leadership are not Hispanic American, well, the disconnect seems obvious, but that's what we have today. So transparency in what we are at this moment. And then number two, kind of actually, okay, once we have the data and know what we are and what we aren't, then thinking about how to actually meaningfully integrate, and when I say meaningfully integrate, I'll speak from my own health system experience. It's very easy to just create like an office of diversity and inclusion and then like put it over here and then roll it out when you need like something on camera, but then tuck it back in when it comes to how dollars are really allocated. You need to actually have like real dollars on the table, accountability, so that it's a threat to both profit and loss ratios, as well as a threat to the very viability of that institution. Because if that starts to become like, even people who don't agree with kind of the nothing about us without us, they'll respond when they say like, this is something that we either do or we sunset this program and we move on to do something that is inclusive. And then for the in-between space, I love the way you phrased it, because I do think about it as muscle, and most of us have lost a lot of muscle in this pandemic because we're not using it. But I think we have to exercise our best muscle, which is our brain. And right now is that time, that John Kingdon kind of policymaking window that we have right now is this time to help kind of teach people. We need to teach the teachers, and we need to actually teach how to manage unpredictable risk. And that includes, I'm a kind of an old school, like that includes scenarios, tabletop planning, and thinking about the worst. In all my pandemic tabletop planning, I did not have a plan for something like COVID, but I can tell you the people who went through that mental exercise even decades ago responded. They were the ones that kind of nimbly responded and had governments who were able to turn an abandoned business into a diaper bank, because guess what? Like moms who were on WIC and SNAP couldn't get diapers easily. And so those are the kinds of things that we need muscle memory to build. And I'll draw it down to like a very simple analogy. One of the most humbling things I did when I was in medical school, very healthy in my 20s, was to actually kind of take on for just 2 hours kind of the role of what it's like to be a cancer patient in that environment. I think we all need to do that. So from CEOs to, people who have had very fancy titles, Sonal, we've all on this panel have had, will have in the future very fancy titles, but like keeping it real by understanding how you walk in people's shoes, that is the most humbling thing I can think of. And that can sometimes give that muscle memory that we need a little bit of a push.
Yeah, that's so important. And I think it's one thing I think a lot about, even myself, Kavita, on a regular basis, is like, how am I living in a community and understanding the community and making sure that I'm not, it's not some theoretical idea, but it's sort of what you are and where you are. And Jessica, you've done that. You have both run a school, you're running you're organizing here, and you've been an organizer. How do we start building those muscles, and what do we need to do more effectively? Jennifer talked a little bit about misinformation and sort of how do we bring that in? You're in between a lot of these places. You're in these in-between spaces. How do we do it? What do we need to do? And what are some lessons that we could learn from that, that we can just say, hey, there's something happening here. Let's learn from that. What do we need to do more effectively?
Yeah, well, I think that we know that misinformation takes hold when social structures, trusts, relationships have broken down. And during this time, I made mention of a different way of operating that I saw from local government. And so as a part of our COVID response on the Southwest side, we saw CDPH epidemiologists come and sit at a table of community-based organizations, community residents that met every single Friday. That table also included the deputy mayor of Health and Human Services, where we were taking a look at data in real time about our neighborhood, making sense of it with EPIs, making decisions about how we needed to act on that data together. And that was deeply useful both for us in community and also for folks on the CDPH side, right? That now had an opportunity to round out a story and figure out how they could support and take action. And while all of that was happening, there was some really deep accountable relationships that were developing between city government where they really hadn't existed before, and community members themselves. And those were, there were moments where there was a bit of a tug of war about what was happening, but the willingness for folks from the city to sit at that table, to be in that relationship, to struggle sort of with us, and come out on the other side has been tremendously helpful in terms of rebuilding some of that trust. But of course, there's a long way to go as well. So.
And can I ask, just let me follow up this question. And Jennifer, I mean, the same question is going to come to you in a slightly different format, but like, Jessica, how do we think about building that communications between communities and government at local, I know you've worked with the mayor's office too, but like, how do we build those communications that the what's happening in communities is being translated effectively for government in order to make decisions? There's data we can look at, which is obviously true. There's also sentiment, right? How do people feel and what's happening? And that's how people also make decisions. How do we do that effectively?
Yeah, the table that I'm talking about was really an opportunity to be in dialogue about all of these things, right? So data wasn't just being fed, right? Data was being shared, and then it was being made sense of together, right? So the sentiment, the need was wrapped up into that, and folks from government were at that table, listening, responding to that in real time, and that was just deeply impactful.
And that's such an important question. That's an important point, because sometimes too often we talk about data and it's like I don't, one of you talked about the giving of information versus engaging in community. And I think this remembering that data is as good as helping the community also understand it and do something with it. It's not just about a transmission, but it is about a conversation, and that is what engagement is. And Jennifer, let me bring you into this now. And again, you talked a lot about the misinformation. You talked about how we effectively communicate. One part of this is it's easy to just make everything political, as you talked about at the beginning, of like everything becomes political. But I think the community wants solutions, right? Nobody's looking for just politics. We want to actually solve problems in our communities. That's what we're looking for. That's where the common ground honestly exists, is everybody wants to solve their problems. How do we bring national politics to understanding that? Because we all sort of say it politically, but we don't actually mean it. And how do we bring it to a point where we're really like, we really do want to solve problems and help communities solve their own problems, not necessarily tell them what to do. But we have resources at the federal, state, local levels. How do we make sure that those resources are with the communities so they have the tools to solve their own problems? No one wants to be dictated to. People want to know that they can do something about it.
Right. And they want access to the information and the resources that they need to be able to come together as a community to solve the problems for themselves. It's hard to answer that question without it being a really political answer, or an answer about politics and how politics works, and how politics is supposed to be about public service. That really is how our founding fathers kind of envisioned this. There were no, the majority of the people who served in Congress in the first few decades of Congress, they went and they served and they went back to the farm because they had work to do. Politics has developed over the past 2 centuries into something very, very different than what it was originally envisioned, at least to be, by the founders of this country. So how do we make, what you're asking is, how do we make politicians work for the community and be more, be instructive and be that connection to the resources we need as in the community? The only way to do that is for the people in the community to develop a better understanding of politics. And what motivates the people that we need to work with us who are sitting in Washington, what motivates them, whether it's good, bad, or indifferent, is getting reelected. That's people sitting in Washington are offended when I say this, but that's what the majority of them have reached, this point where the way that the 2 major parties function, it becomes about getting reelected. Why are we coming out of this, devastating loss of life from a pandemic that was terribly mismanaged by certain members of government? And try, we're all in this conversation trying to think, how can we learn from that and move forward? How do we not confront this? How do we not have to confront this again? But in Washington, the Senate, Mitch McConnell has repeatedly stated that his focus, his goal, is to make sure that Joe Biden is a one-term president. where's the that is such an extraordinary disconnect. It comes back to us in the community. It's on us. People in the community have to understand how politics work better, and they have to have that manifest on election day in a way that it hasn't. We've become kind of lazy supporters of democracy over these past several decades at least. We've taken things for granted, and we paid the price for that last year in what happened in this pandemic. So I think that I wish I had this data point in front of me. They do these surveys and polls over and over again about how people vote and why do we keep voting the same people back into office. And there are a number of polls out there that will show, the first question is your satisfaction with Congress. And it's in the pits, right? Nobody is satisfied with Congress. Their favorability is in the toilet. And then they say, what about your congressman? And then it always goes way up. My congressman is great. Should we vote everybody out of Congress? Yes, we should vote in all new people. Should we vote your congressman out? Oh no, my congressman's doing a good job. Like we have this idea. So we've got to become better informed members of the political process. We can't buy into this idea that so many Americans do. They'll say, oh, politics is ugly. I don't like it. They're all the same. I'm going to ignore that and just do my thing over here. But for the efforts that Berto and Jessica are trying to execute in their communities, we're talking about who gives us information, who do we trust, where does that come from? We have to be able to trust government. We have to be able to, and I have come to the conclusion, personally at least, that that's not going to change. That's not going to change from government. It has to change from the community, from voters. A very quick little story about why we trust different sources and where we get information from. My 25-year-old son had been trying to decide whether or not he should get vaccinated. And he listened to his father and I, who gave a very compelling argument for vaccination, but he also listens to podcasts and his social media feed and other, all these other individuals in his circle who had and I will say, this is kind of a side note, millennials' distrust in government is probably at a record rate for a generation, and that's dangerous. That is not good for the future of our country. So that's my son. He ultimately got vaccinated because of this is my 25-year-old son, his 25-year-old friend, who is a medical student and becoming a doctor, explaining to him exactly how the vaccine works and why it was important for him to get it at 25 and not wait till he was 45 or 50 and see if he made it that long without catching the COVID virus. So I think that, it becomes communication is a very complicated web of interactions, and I think I may have gotten off mark from your original question, but I hope that that's useful. I think, and it goes back again to what Berto said early on. We have to, if we want young people or communities of color or LGBTQ communities, or, if we want all of these different people, all these different communities to trust the information that comes from government, then government has to change how it's functioning. And what happened last year was a total collapse of government accessibility, reliability, communication of accurate facts, all these things. So that has to be rebuilt. But they will not take that step, take that action, unless we on the voting side force them to.
Well, I've never been in a conversation in recent times where democracy isn't the basic conversation we come back to, because I think it's such an important conversation, an important issue. Berto, let me talk about this, because let me bring you in on this particular point, because I think what Jennifer is talking about is really how does information get communicated to community leaders, and how do those community leaders transfer that information, but how do we build trust in our civic institutions? And I don't mean just government, but just also like our voting, how do we build our civic muscle too, and making sure that we're paying attention to it? How do you see it and where you are?
Yeah, well, one of the things I just mentioned really briefly is that I didn't get connected into civic life until, an organization like Mikva Challenge gave me an opportunity to get plugged into seeing this world, right, the civic arena. And I used to think that, elected officials and government, that was the main way to make social change happen. In the last year, and through my organizing career, like I've realized that you don't need to be an elected official or government to make a difference. And that in fact, as Jennifer mentioned, there was a total collapse, right? In our neighborhoods, it was like a total state of emergency, right? And it wasn't government who came to help us. It was community residents like banding together, giving people food when all the stores were closed, keeping some semblance of unity when there was tension between Black and Brown communities, right? And when I think about our civic muscle, I think there's a lot of ways, untraditional ways in which our community exercises that civic muscle that go really unnoticed, right? And so in the last year, a lot of the ways in which I saw that was neighbors helping each other establish mutual aid networks, right? We established a street vendor relief fund where we would give street vendors direct cash assistance of $500 to be able to cope with the pandemic, right? All of those are examples of civic muscle, right? Of building coalitions when we've seen that in state of emergencies, we have to rely on ourselves, right? And that unfortunately, and I don't have the answer for how do we build back that trust between civic institutions, right? But I do think it starts with listening to the folks that were there during the total collapse and not letting anyone erase that history. Like the fact that it was community residents, community organizations, community partners who came together when everything else fell apart. And it's going to be those folks that are going to be important for us to listen to as we rebuild and as we reimagine what safety looks like, as we reimagine what real public health equity looks like. And so in essence, I think in order to build back that trust, our the government like needs to earn that trust, right? Because it's been really lost. And so earning that trust, I think also just is about listening.
Yeah. Jessica, when you sort of think about this point that Berto's making about re-earning trust, and you think about it from a mayoral, or from a city perspective, what are the lessons that we need to take from both COVID? I mean, I'm sort of with Jennifer a little bit. Let me just step back for a second. I worry when our young people don't trust government either. And that as we think about democracy, it matters that we sort of build institutions that are trusted, and we need to rebuild it. It's bit by bit, community by community. How do we think about doing that? What are the work that you're doing on racial equity? How do you think about building that together?
Well, I think you're getting at the solution there. I think we need civic leaders who are willing to sit at tables with community to do what I talked about initially, understand the community voice as expert, actually concretely follow through, respond to what's being said, and be willing to make yourself vulnerable, right? So that you're actually in authentic relationship with community members at community tables. And I think, I don't know if it was Jennifer that talked about political process, right? It makes it very difficult for civic leaders, for our elected officials to do that. But I think that is fundamental to being able to move to a more trustful space.
Yeah, I hear you on that. And I guess the question I have is a little bit of more, let me probe a bit deeper here, is like, how do we take from what you're learning at local levels to how do we move it to state levels? How do we move it to the federal levels? Like there's this connection that needs to happen because, I've noticed that federal government is now reaching out to civic leaders themselves, but there's not a link to cities. And like, there's more that we have to think about, because if we start cutting lines, then we're also building in new approaches, but we may not be hearing everything that people are saying.
Sure. And then I think it's sort of apropos that we've spent a lot of time talking about communication. And then my brain naturally goes to thinking about what are those systems of two-way of engagement? What do they look like between federal, state, local governments and community? There are brilliant organizational theorists out there that I'm sure can design us a communication model where we're actually, moving the voice of community through those channels, so that we're able to engage and respond at every level. That's my first best thought. Yeah. It is about vulnerability. I think it is also about coherence and being able to actually really set up the right systems and structures that allow for the sort of engagement that Berta was talking about earlier.
Yeah. Jennifer, just quickly, and then I'm going to end with Kavita. What Jessica talks about is like, how do we have this level of communication that's consistent and that we're hearing feedback loops in the process? Kavita also mentioned it at the beginning. When you think about building a comm strategy, how have you thought about like ensuring that information is not only being transmitted, but you're getting the feedback loop?
Well, from from an organizational standpoint, a political campaign, a nonprofit organization, any that sort of thing, and you look at a comm strategy, you're looking at all of the different tools that you have. And there's no question that the most effective tool in communication these days is social media. I don't think it's necessarily healthy that that's the most effective tool, but that's the case. That is the most effective way to get specific information in front of specific human beings. The ability to target, the ability to, use the digital tools behind the panel, behind the scenes of social media. That's the most effective way to communicate. The problem is that we as individuals choose, sometimes consciously, sometimes subconsciously, human beings choose to live in echo chambers. We have this instinct as human beings to listen to and to put ourselves in front of people and groups and news sources and information sources that already reflect back what we already either believe or have an instinct or a sense is true or could be true. That's the biggest problem right now with communication, and frankly, it's the biggest problem with everything that we're talking about today, actually, right now. Do you watch Fox News every single night for 3 hours? Do you watch CNN every single night for 3 hours? If you have one source that you are kind of addicted to, that you go to all the time, then it's not possible that you are getting the full spectrum of accurate information. So again, it comes back to us, and we have to be, much more self-aware and be willing to to be kind of honest with ourselves about ourselves, which I think is difficult for us as human beings to begin with, that we have to be more self-aware and we have to make these conscious choices. So what can all the people in this panel do, all the different connections, all the different organizations and efforts that we're part of? One of the most important things that we need to do as a nation going forward, that we need everyone to be part of, is to educate people on consuming information, consuming news, consuming knowledge. So it's not necessarily it's not the most important thing. It's obviously, it's very important to know what is true and what's not true. In this moment, we need to teach people how to gauge that, how to process that. And whether it's Berto going into his community and addressing, the specific needs of in any given moment, or being part of political efforts that are trying to reach out specifically to women, or whatever it is, we as a nation, we as a community of Americans, we have to do a much better job of processing information. And I think I think that is an effort that all of us who are in positions like the folks on this panel have to make part of what we're doing, and kind of at the top, a priority as part of everything else that we do.
Yeah, Jennifer, I think that's a great point. Kavita, I'm going to end it with you. I know we're sort of at time, but really just COVID, just thinking about this comms piece, but really COVID has sort of exposed a lot of fault lines between different levels of government. And just if a short, I know we could do a thesis on all of the questions that I'm asking, but what a short thing of like, what are things that we should start thinking about how do we start during crises, bringing different pieces of government to talk consistently. I think the administration's done a fairly decent job on COVID moving, the Biden administration's done a fairly decent job, but what else do we need to be doing to make sure that there's a consistent communication?
Yeah, I think it's just briefly like scanning the kind of pre-pandemic structures and then looking at whether it's Berta's organizations, kind of looking through exemplars and thinking about those structural elements. And honestly, it goes back to something that all of us do on a daily basis, creating a checklist. I think we're lacking very kind of actionable tools, and can't think of a more actionable tool than saying, because what people want, Sonal, even leaders want it. They want a checklist of what are my gaps and what are the ways to fill them. And I think that this is the kind of group, and hopefully the people coming out of the university will work on that, because we need it.
Well, thank you all for this great panel. I think this is such an important conversation. Sadia, I think this is also Center for Effective Government. This is so much of all the work that you all do, but it's important that we have these conversations and be able to talk about the fault lines, but also what are lessons that we can learn and make it simple. I don't think we need complicated solutions. I think what we really need is fairly simple solutions. What can I do in my life? What can somebody else do in their life that we can all sort of aggregate up to something? And there's a lot of good information here, not forgetting community, ensuring that the community can get the information, but translate it in the way that it works. Thinking about how to aggregate and communicate, really thinking about the work that Jessica's doing, and in ensuring that there's a racial justice element to everything that we do and where we do it. Jennifer's points about, where is the information coming from? Who is the information coming from? How are we communicating it? And then I think Kavita's, she's right. We could write a dissertation on each of these topics that we're talking about, but really, I think this is work that from where you are, there's a lot that universities like University of Chicago and the work you're doing can help, make it easier.
Absolutely. And thank you so much, Sonal, for guiding us through this conversation. It's been incredibly thoughtful and thought-provoking, and I suspect there will be follow-up conversations that come out of this, let alone dissertations. I just want to thank you all again. Thank you again, Sonal. Thank you, Kavita, Berto, Jennifer, and Jessica for taking some time to be with us, especially towards the end of a lot of Zoom fatigue. We really appreciate you all taking your time to be here with us. And for those of you that are new to the center, please do follow us at UChicago CEG on Twitter. And you can visit us on our website at effectivegov.uchicago.edu. And that's where you'll hear about our latest events, as well as some of our research findings. So thank you so much. And I hope you all